everyone, my name is Rowan Spence and I'm a fourth-year pharmacy student at Virginia Commonwealth University. Growing up, I was always surrounded by the medical field and knew I wanted to be a part of it. Once I turned 18, I began working at a community pharmacy and fell in love with the field and knew outpatient pharmacy was where I wanted to begin my career. After graduating from Christopher Newport University, I knew VCU was my next step. As soon as I got here, I tried to get involved in a bunch of organizations. One that always stood out to me was the American Pharmacists Association, often termed APHA. One of my favorite initiatives APHA started was offering training to students for a diabetes prevention program, or DPP. I was really looking forward to working with patients over the year, but unfortunately that was put on a pause due to the COVID-19 pandemic. I was initially drawn to the diabetes prevention program because helping patients understand chronic diseases is one of my passions in pharmacy and what I think is a growing field for pharmacists. I reached out to other faculty involved with DPP at VCU in hopes of getting myself involved, and I was directed to Dr. Dixon. During the spring semester, I completed a research elective with Dr. Dixon, and we began working on our project titled Survey of CDC-Recognized Community Pharmacies Providing the National Diabetes Prevention Program. The Center for Disease Control has a list of all CDC-recognized diabetes prevention programs, and so the first big step was creating the survey and calling the 73 pharmacies on that list. Then, once all the pharmacies were called and responses began coming in, we could start to pick up on trends in community pharmacies who were offering DPP. I really enjoyed learning about the diabetes prevention programs and how community pharmacies were getting involved. As I mentioned earlier, community pharmacy is one of my passions, and I think diabetes prevention programs are a great way for pharmacists to become more involved in the community and to work on interdisciplinary teams. One of the reasons this research was so important to me was because I want to work with patients to create long-lasting relationships and see how small steps over time can create a huge difference in their lives. I really cannot thank Dr. Dixon enough for taking a chance on me to help with this project. This was my first time completing research, and I had always viewed it as a very daunting task. But with the help and guidance of Dr. Dixon, he helped me break the project down into small and manageable steps. We completed the data collection back in April and are now working to take the research further. In May, I presented our poster at a virtual symposium through the American College of Clinical Pharmacy and ended up winning first place in the Practice and Research Network competition. Overall, I just want to say thank you to VCU and thank you to Dr. Dixon for providing me with the opportunity to complete this project this past semester and turn it into a piece of work that I'm really proud of.